the motivation behind the study was really us noticing very quickly the different tactics that were taken by our respective governments, with the Republic of Ireland leading very much with a suppression and elimination type tactic, being very conservative, going very quickly in terms of shutting things down. And in the UK, you know what we've had. We've had the Cheltenham Festival, we had the Champions League game, we had many delays, shall we say. So that was the main sort of driver behind the study, to really try to understand whether or not these key sort of strategy type differences would play out in terms of the way the frontline workers were feeling. And I think, you know, a really important factor that Elaine highlighted there is that we've not just looked at healthcare workers, we have incorporated those, but we've also incorporated a huge amount of other workers as well on the frontline. One of the key differences in terms of these psychological sort of welfare variables that we've been looking at, we're also asking our participants how they felt about the government's response, whether they considered it to be timely, effective, or appropriate. And for each of those metrics, those in the UK have rated lower, basically, in terms of their perception of the government's action, particularly in that first point that Elaine was speaking to first. And this seems to be a really important driver of each of those outcomes. So whilst well-being and well-being was lower, burnout was higher, resilience was lower in the UK, this was all being driven very, very much by the timeliness, their perceived timeliness of the government's actions. So we have poorer psychological outcomes in terms of mental health and well-being, and these are very much driven by the workers' perceptions of how the government has chosen to tackle the pandemic.